Hello everyone, this is Dr. Rifat Alimon. I am one of the founder and mentor of the PACES Care team. Today, in our today's video, we'd like to share some views about the tips and tricks of Station 5, that is brief clinical consultation. In brief clinical consultation station, there will be two BCC, that is BCC 1 and 2. You will get 10 minutes each for each of the station, and you will get 5 minutes, and you will be given two paper in which there will be a written scenario, and you have to formulate the possible diagnosis, the possible management plan, and also possible differentials, and how do you like to meet the concern of the patient. You have to formulate the plan just within the 5 minutes. And after entering the room, just try to divide your time into three parts. First 3 minutes you will take the history, first 2 minutes you will examine the patient, and then you will get another 1 minute. In this 1 minute you try to take another history that is important, and if anything is left for examination you can do that. After 6 minutes the teacher will warn you that you will have 2 minutes left. Then in the last 2 minutes try to formulate the management plan, formulate the differentials and investigation plan, and meet the concern of the patients, and get ready after 8 minutes to encounter the teacher's question. So overall the Station 5 is worth of many marks in the exam, and it is very crucial to dedicate a substantial proportion of revision time for that. So what you need to do, you have to carefully read the instruction what is given just outside the room before entering the station, and brainstorm the specific question you need to ask to help to get the diagnosis. On entering the room, look closely for any clues of diagnosis, because actually many of the Station 5 scenarios can be diagnosed on the spot diagnosis, like the rheumatological cases, like the endocrine cases. You can enter the room and you can see that there is a neck swelling in front of the neck, so you can have an idea that their patient might have some goiter. You just enter into the room and see a tall statured patient, so you can have an idea that the patient might have some Marfan syndrome or other differential diagnosis. So try to have a clue, okay? And generally begin with an open question, like usually you need to ask what is written in the scenario, like the patient might have some fall, patient might have some syncope, patient might have some headache. So try to sort that question first, and then quickly please become focused after this. Establish a likely diagnosis and also the differentials also, then find out about any specific complications. Examination generally involve looking for any specific sign that correlates with your history rather than following a set pattern. Like in case of if any patients with Marfan syndrome is given in your Station 5, what you need to do, you don't need to perform the full pre-coded examination. Rather, you can just auscultate for the any presence of any murmur present or not. So the examination must be focused. So the motto of the Station 5 is that focused history, focused examination. So be sure to examine for any evidence of any complication of the primary disorder, like the patient might have some rheumatological disorders, any chronic illness like hypertension, diabetes, bronchial asthma. So try to look for any evidence of the complication of the disease, and try to look for any complication of the drugs also. When presenting the case, give the likely diagnosis first, but have differentials available in your case if you are asked for this. Always ask about any specific concern that the patient has, and provide a solution or an explanation, whatever it is appropriate. Try to meet the concern as much as possible, because without meeting the concern, you will not get the mark. And addressing the patient's welfare and concern is very vital in this station. Don't be panicked if you can't find any diagnosis. Just tell your history and examination finding to the examiner, and there is a possibility that you might get a very good amount of number. So keep in touch with our PACES Care YouTube channel and subscribe our channel so that you can get the regular update of the channel. Thank you.